All right, very good. So I'm hearing a lot about what are next steps, what are we going to do with all of this information and do this now. As I mentioned when I first opened, this is a multi-year program in partnership with Robert Wood Johnson, but also with everybody in the room, everybody on webcast, anybody who basically wants to come along with us and share your knowledge and share any documents or resources that you have. We will be building, we have, as you saw in your Dropbox folder, background documents. It's very small right now, relatively speaking. I think it could be much bigger. Send in your information, send in your research studies, send in your published documents, send in your models, anything that's written up, send it to us. Make sure that it's already public and it's not embargoed or anything like that, because we want to make sure that we collect all of those and those will help inform us as we move along. We ourselves internally, we're being a little bit internal thinking as well, and we've done an inventory of all the work and all the findings and recommendations that the Academies has done that's related to health equity in a culture of health, and I've seen it. I've seen the raw data. There are 583 entries in an Excel spreadsheet right now. So we have a lot to sift through. There's going to be a set of interviews and then a short document that'll be written up on that. So stay tuned for that. So how you're going to submit those documents, we've decided with our team that what might be most efficient is if we send all the registrants an email with SurveyMonkey. And through SurveyMonkey, you can attach a website, you can attach documents and so forth. If you have any problems, you can just contact us about that. So right now, we have a few of our advisory group members here. We're going to actually go into a closed session now, and we're going to debrief ourselves before we become too brain dead and too overwhelmed with all of the tremendous information and stimulating ideas that we've received from you all today. We're going to come up with a handful of potential topics for the next consensus study, and then we're going to go through a process at the Academies to vet those ideas and then come up with the next topic, and we'll be sending out an RFP internally at the Academies for our groups to respond to that. And so there will be a next consensus study for that, and it won't be the last one. So this isn't the last chance for us to do a study. There will be at least one more. And I'd like to say that what we'll do is when the next consensus study launches, which I believe will be late spring, hopefully at the latest, we'll also get this group back together again. If you're signed up on our listserv, if we have your names and emails, and if you can connect us with other people to sign up on our listserv, we'll have another meeting. It'll launch off. You know, that consensus study will all have done more work, collected more documents and data, come back, do more sharing. So this will be a learning community as we travel down this road and go on this journey together. So I want to thank everybody, and safe travels wherever you're going, locally, domestically, or internationally. And you'll hear from us very soon. Thank you.